I'm a senior staff at the Holon Institute of Technology in the south of Tel Aviv. I'm a medical informatician and public health specialist. I'm also, and that's something that will support also my presentation today, the representative of the Israeli Society Association for Medical Informatics at the European Federation for Medical Informatics. They're the executive officer and the working group co-chair for One Digital Health, which is a new field that we developed with some partners that I will introduce also next, and also the chair of the co-chair also of the same working group at the IMIA, the International Medical Informatics Association. So I will introduce One Digital Health, ODH, in the next couple of seconds. And globally, that's what I can say specifically to this talk. So One Digital Health, and you can see also a beautiful picture on the background. We'll discuss about it. So One Digital Health is a relatively new field of research that we developed in collaboration, myself, Dr. Oscar Tambouris from Italy, Professor Anne Moen from the University of Oslo in Norway, and Catherine Kronecki from HL7 Europe. All of us are also members of the European Federation for Medical Information Council, and each one also active members in our academic institutions. So during this short presentation, I will introduce briefly what's One Health, digital health for reminding globally what is this, and how we integrated both of them under the umbrella of a new umbrella of One Digital Health. Then we'll discuss how we are and we need to involve citizens. What will happen with ODH in this relatively new millennium, because we are looking forward than this decade or century. And then if we are talking about One Health, digital health, One Digital Health, and globally, all the technology supporting human, animal, and environment health, we need to look at how we will train the next generation of professionals. For looking back to the previous presentations and also the panel, it's really important to have in mind that, and a large part of you will and are naturally understanding this aspect, when we are training healthcare professionals or professionals which will deeply be involved in healthcare processes, we are training them at or for particular capabilities at a particular date. And what will be with each one of them 10 years, 2 decades, 30 years later, it's hard to define. And the One Digital Health framework that we will discuss about is trying to give some answers for the future. So globally, what's One Health and why we are discussing about One Health and digital health together? One Health is globally an umbrella looking at the same time at human health, animal health, and environment health, ecology, and try to understand the connections between all these different worlds, and to support the common research and common practice, unified practice between them. So it's important to understand, and during the COVID-19 pandemic, we saw it. It's really important to have today deep framework for supporting collaboration between health practitioners, public health workers, researchers, specialists, biologists, environmental specialists, veterinary medicine practitioners, and so forth. And going outside of our classic silos where human medicine practitioners are looking only on humans, and animal practitioners, veterinary medicine practitioners, are looking on animals or all related processes and less on human. So the digital health in parallel is a set of technologies that allowed and still allows and will allow to accelerate biomedical research, to improve medical practice, the daily medical practice at the individual level, and also for improving public health and the efficiency of decision-making processes there. And when we are looking at One Health and digital health, it's impossible to don't think about the connection between them. Today, we have for humans the electronic health record, but we have also the same kind for animals. For humans, we have the healthcare management organizations with shared EHRs. In veterinary medicine is more challenging. When we are talking about reactions of patients, of pollution, of environmental events, we have the same for animals. And what we are doing also as humans is impacting this environment that will anyway further will impact ourselves or animals, or the environment will be impacted. And we know it about today more clearly with the challenging issues of climate change. So when we started to look at these two concepts together, we understood that we need to define a new kind of concept that we called One Digital Health, unifying or trying to unify the readability of One Health and digital health. That's what we are defining in our One Digital Health steering wheel. The keys of our model are One Health and digital health. And when we are looking forward, we can understand that we are also three different perspectives. When we are looking from the One Health perspective, we can look at the individual, a human or an animal health and well-being. When we are looking at from the digital health perspective, we can assist an individual anyway, if it's a human or an animal. From the perspective of the population and the society, it's the same from this different, the human and animal perspective, but also from an, if I can say it like it, a botanic perspective for plants, which can be also impacted and are defining some population. And all of this, when we are looking at One Health, we are looking at an ecosystem. And also the digital health tools are allowing us to monitor an ecosystem where we have individuals and populations. So saying that, we need to look at the individual, at the population, at the ecosystem perspectives from 5 different dimensions. And we have there, I will start with the most simple one from our perspective at this step is the human and veterinary healthcare. We want to take care about humans and animals, and we want to improve their well-being and to reduce burden. Then we cannot today did it without having good partnerships, and the previous presentations pointed it out clearly. We need the involvement of the healthcare industry, the 4.0 industry, having the Internet of medical things involved, the Internet of people, for allowing us to monitor human health, animal health, the environment, and to be able to share data. Then I will move at the second side when I'm saying that about the healthcare industry. We need also to look at One Health, digital health, One Digital Health from the dimension of the environment. Where are we looking about these individuals? Why? What is the impact of the environment on the whole ecosystem, including individuals, population, and other systems, and how we are impacting this environment? Then we need to look at the dimension related to education. And this course and this lecture are a part of the One Digital Health or ODH model, because we need that people understand deeply what's One Health, what's digital health, what's One Digital Health, and why we need a unified approach looking at these perspectives and dimensions together. Because if we are training right the future professionals today, we know that in the next decades, they will be able to have a systematic approach, not looking only on humans or only on animals, or only on vegetables, and a large understanding of environment, but looking at all of them as a whole. And the COVID-19 pandemic was an example. How did it start? We have a lot of hypotheses, but anyway, the coronavirus is mainly located and spread in animal populations. It moved to human, and we had also different hypotheses during the pandemic that the climate of the different hemispheres has an impact there. So it's also something to understand from an educational perspective. And the most important point when we are looking at health is the citizen engagement. Why? Because I need to report what's happening with myself, but I need to understand what's happening with others. If I have a pet, I need to report if I saw something, or if I'm discovering some issues in an environment, a pollution event, an hazard event, I need to report. I need to teach others how to react. And all of these perspectives and dimensions of the ODH model are linked by what we are calling the technologies ring. We cannot do anything, nor in healthcare, from the industrial perspective, environmental perspective, educational perspective, but more engagement of each citizen or patient-citizen today, or citizen-patient, without technologies. And like we discussed previously, we need smartphones, tablets, networks for allowing this deep interaction at the individual, population, and ecosystem levels. And how we are doing it, and why we need technologies there. So we cannot look forward without taking into account the need of interoperability. If we are looking at the electronic health record, we have today new frameworks like the X-eHealth, allowing to align the different needs and to confront them with the right governance, and to improve the development of the different data exchange standards. And it's something crucial, not only for human health, but also for human health. When we are eating some meat, if we are looking from this point, we need to know what we are eating, from where the meat is coming from, what was the different processes involved until we get it on our plates, because it can impact our health, and we can remember different events from the 80s and 90s with the Creutzfeldt-Jakob disease. So when we are looking at the standards, and for developing these standards, we need the support of the community of practice, meaning that we need to understand the needs of the practitioners, of the patients, of the policymakers, of the HMOs or hospitals, the deployers, and how we can assist them to more efficiently share their data. And in parallel, when we are understanding the needs of these actors, we can go forward by developing more accurately, more efficiently, the right products, APIs for allowing connection between platforms, having common terminologies between different professionals, and so on. So, saying that, we need to look at One Digital Health as like some tool allowing us to fight a pandemic, to fight and to work against hazardous and disruptive events. And if we are looking at the COVID-19 pandemics, the WHO Europe launched a pan-European call for developing the right approach to response to the pandemic. And there, they defined that we need a data governance framework. So the ODH framework can here support by showing that the governance must take into account human, animals, and ecosystem data. Leverage the power of data, the data operationalized, the data allowing us to operationalize the ODH. So we need data, we need to collect them, but we need the framework defined previously. We need the right framework, how we will get data, how we will connect all this data. And if we are looking at this framework, requested by the WHO Europe, we can see here the One Digital Health framework like I introduced it previously, and allowing to answer to the different calls of WHO, allowing to improve policy making and also supporting the enhancement of technical expertise. So near the end, looking at the industry and looking at the development of these different tools, we need to understand how the citizen can be helped by the ODH model. So like I discussed previously by showing the model, education and citizen science, it's something new, emerging, and we need to engage the patient, the citizen at any stage for being able to share with the right digital health knowledge to develop digital health and globally health literacy for allowing each one to understand what's happening and how we can enhance the global health. The citizen engagement is also creating new opportunities for contribution sharing and supporting ODH. If we are looking at vaccines, engaging people to take a vaccine and to share and to explain why we need, but also why it's ethical to take it or why it's ethical to wait for different approvals. And if we are going forward with veterinary and human healthcare, it's the same and similar. We have different tools focusing on the patient, focusing on the public health informatics. And today, the industry is really deeply involved here for developing tools supporting humans and animals. I'm finishing in 1 minute.
Okay.
So globally, the next steps is looking also at the different goals of WHO for developing the suitable development goals defined for 2030. One digital health information interventions, how we will be able to take the current framework for moving forward, to support the new challenges involving human, animals, and environment systems for improving the healthcare globally and global health. And for this, we are defining digitalities, the digital humanities, the digital animalities, and environmentalities, meaning that we are looking at the different levels, human, animal, and environment, from a digital perspective for collecting data. And that's what we are calling the ODHness, how we are fitting the ODH framework in the better fit by looking at these different dimensions. So we want to improve this framework by developing different tools. Today, we are validating this methodology with different approaches. We are developing also different way to build the ODH interventions by looking also at fair data and fitting with the fairness. And to conclude, the seminal paper of ODH has been published 1 year ago in the Journal of Medical Internet Research by Anne Moen, Catherine Schronacki, Oscar Tambouris, and myself. And you have here the link. You can search it also on PubMed, on Google, anywhere, and more on the JMIR website. Thank you for your attention.